welcome again to the Dr. Ridwan Show, health information you can use. Today's episode continues with the issue of low T or low testosterone, or what we call in medical terminology, hypogonadism. And we have our guest experts, the urologist, Dr. Ajay Nehra, and the family medicine specialist, Dr. Matt Rosenberg. As we discussed, we know the role of testosterone, we know where the testosterone comes from, we know its effects in the body, but what are the symptoms that are associated with low testosterone, and how does the patient present in your practice?
Yeah, that's a great question, because that's how what the patients want to know. And I think historically they've looked at these symptoms of being sexual. We know about erectile dysfunction and libido, but there's so many other symptoms that go along with low testosterone. For example, the issues about just overall well-being, or muscle mass, or mood, or memory concentration. What kind of things are you seeing?
I mean, that's the beauty of Dr. Rosenberg talking about a primary care perspective, because we in the urologic arena are seeing patients who present, as you said, low libido, poor ejaculatory function, just a low desire. And then as you start to talk to them further, they'll say, "Doc, you're right. I'm thinking about it. I used to be able to exercise a lot more.
Right.
I get fatigued a lot easier. I'm not able to sleep well at night." And when you start to then talk about recall and memory, the spouse will invariably say, "The memory may be not as good as it was." So I just want to get your perspective, Dr. Rosenberg.
Yeah, no, I think that's a great point. I think for us as primary care physicians, if we can actually see that association, then we're going to realize that a lot of these symptoms that come off that are non-sexual can actually be leading us to a diagnosis of low testosterone.
Now, you said earlier, Dr. Nehra, on this show that hypogonadism or low T is very common. And I would guess these symptoms are also very common, and they are shared by this entity, the low testosterone, and also by other things. We frequently see in practice patients who have had these symptoms for a long time, maybe months, maybe years, before they are recognized as low testosterone, maybe before they get a blood test to make the diagnosis of low testosterone. What is the reason of the long time before the diagnosis is made?
It's a gradual process. It's not a switch shutting on or off overnight. So whenever something occurs gradually and it's progressive, there's a time where invariably the partner or the spouse will suggest that an evaluation is required. And more often than not, in those scenarios, we're able to find out, indeed, the symptoms are indeed parallel with a blood test itself. Right. What do you think, Dr. Wilson?
No, I think that was a perfect explanation. You know, as a primary care physician, I see myself being very symptom-driven. You know, patients home in, I have a runny nose, it must be a cold. Right. You know, I have a cough, it must be bronchitis, or my blood pressure is up.
Of course.
And I think historically we've been used to patients coming in with sexual issues, or when they do come in with sexual issues, and saying, "Oh, it must be your testosterone." And I think we're still working on that educational gap and trying to get people, both patients and physicians, to realize that there are other symptoms that may be indicative of low testosterone. Now, one of the key points here is there's no symptom that's specific for low testosterone. There are many symptoms that are suggested for it. And I'm hoping that as our patients and clinicians keep an open mind, they can see that that low testosterone may be a problem that they should address.
Excellent. Now, I wanted to ask you about the question of male infertility. Is that part of hypogonadism or low testosterone?
In a small percentage of patients, absolutely, it can be. And that's why it's very important that men who have infertility and who are diagnosed with hypogonadism should really be evaluated by a specialist such as a urologist.
Right.
I think it's very important. It's integral. These are men who are classically younger, in early relationships, seeking a parenthood, and a formal visit to a urologist would be ideal in this perspective.
Now, the reality, though, is a lot of patients may be having this for a while and may not know who to turn to. So frequently what will happen is they'll go to their primary care physician, who hopefully will be able to initiate the process, and most of them will, and then be able to send it off to the urologist. Now, even with my specialty in medical urology, I'm not going to work that up, but I'll tell the patients, look, usually we go by 12 months if you haven't been able to reproduce, yeah. And I will ask them to get a semen analysis, but I will refer them to the urologist at the same time and send those results right over.
So I think what we have learned from you regarding the question of symptoms of low testosterone or hypogonadism, that the symptoms include sexual symptoms such as low sexual desire, erectile dysfunction, difficulty with orgasm and ejaculation, but also includes non-sexual symptoms such as easy fatigue, weakness, low muscle power, low motivation, and also some mental symptoms such as inability to concentrate, difficulty with memories, and in advanced cases, maybe even other symptoms and signs such as osteoporosis or anemia. Many of these symptoms are not specific to hypogonadism or low testosterone. That's why if someone has these symptoms, the person or the man or someone who observes these symptoms in the man should report that to the doctor, to the primary care physician, and the diagnosis can be made easily, and consequently treatment can be very effective. Sure. And we will continue the conversation on low testosterone, hypogonadism, and testosterone therapy on the next segments of the Dr. Ridwan Show, health information you can use. Please stay on and come back to www.drridwan.com.